Hello, how are you today?
Good.
I'm going to wash my hands. My name is Julia Hamilton. I'm an NP student at South University. I'm here today to do your head-to-toe assessment. Can you tell me your name?
Julia Wise.
Okay. And how are you doing, Miss Wise?
Good.
Okay. And can you tell me your date of birth?
6/7/84.
Okay. And can you tell me today's date?
January 12th, 2017.
Okay. All right, good. So the patient is alert and oriented. So I'm going to move along with this assessment here and check your head here. There are no abnormalities I'm feeling, no lesions. The hair is equally distributed on your head. Are you having any pain when I touch your head?
No.
Okay. Now, wrinkle your forehead. Okay. And let's see. Let me get you to remove your glasses there. And I need you to close your eyes against the resistance of my fingers. Okay, that's good. Now, puff your cheeks. Good. And clench your teeth. Okay. And everything is symmetrical there. Good. Okay. I'm going to palpate your temporal artery. Are you having any pain there?
No.
Palpate? Okay. I'm going to get you to open your mouth. Okay. Now move side to side. Okay. And close your mouth. Now, hold your mouth closed, clench your teeth, and I'm going to try to open your mouth. Okay, good. Did you have any pain?
No.
There, okay. Now I'm going to palpate your sinuses here. Any problems with your sinuses today, Ms. Wise?
No.
Okay, that's good. All right. Now I'm going to check your eyes, and I have already checked her visual acuity with the Snellen eye chart. The left eye was 20/20, the right eye was 20/20, and both eyes were 20/20. So I'm going to test the confrontation. Can I get you to put your left hand over your eye and just look straight at the wall and tell me how many fingers I'm holding up?
2.
Okay. And how many fingers am I holding up?
2.
Okay. And once again?
2.
Once again?
2.
Okay. Good. Now I'm going to get you to look at my, okay, you can remove your hand. I'm going to get you to look at my nose.
Okay.
Okay. And I want you to follow my finger here. So look at my finger. Close your eyes. Okay. Good. Okay, that's good. So I need to inspect your eye. So I'm gonna look at your eye here. And just don't look at the light, just look at me. Okay, hold your eye, close your eye. Or look down, I mean. Okay. Okay, good. Her conjunctiva is, sclera is white, no problems with her eyes there. You had any irritation or anything with your eyes?
No.
Okay, so I'm going to check your, just look it straight at me. Okay. Her pupils are equal, round, and reactive to light and accommodation. Okay, so now I'm going to move to her ears. I'm going to Inspect her ears and look inside. Have you had any problems with your ears, Miss Wise?
No.
Okay, so I'm gonna push on your tragus here. Tell me if you have any pain with that.
No.
Okay. And her ears are symmetrical on both sides, as we see. So I'm gonna pull her ear here so I can look inside. Okay, so there. I'm gonna move to the other side. Okay, when I press against the tragus, are you having any pain there?
No.
Okay, was any pain?
Mm-mm.
Okay. Okay, and we have already performed the hearing test, or the whisper hearing test, and she has passed bilaterally at 5 feet. So we're going to inspect her nose, and the nose is intact and symmetrical there with the face. I'm going to look at her nostrils. Have you had any problems breathing or anything with your sinuses or your nose?
No.
Okay. I'm going to look in your mouth. If I could get you to open your mouth, stick your tongue out. Okay. The uvula is midline back there, and it moves up and down. Your teeth is intact, and the buccal mucosa is pink, and her palate is intact. See, now I'm going to explain how I would test her gag reflex. How I would test her gag reflex is I would take a tongue blade and advance it almost to the back of her throat there, just enough to get her gag reflex going, and then of course I would remove it at that time. And as I was checking, she didn't have any odor or anything. And stick your tongue out for me. Her tongue is midline. There's no tremors to her tongue. Okay, now I'm going to inspect your neck for symmetry, and I'm going to feel for any lumps or abnormalities of your neck there. And I'm palpating your lymph nodes. There's no enlarged lymph nodes. And I'm going to listen to your carotid pulse for Roy. I'm going to listen with the bell of my stethoscope. And I have already palpated it. Okay. Good. Good. Okay. And her trachea is midline. Okay. And I'm going to test the range of motion in your neck. If I could get you to lean forward and lean back and touch your shoulder with your ear, and the same thing with the other. Now I'm going to check your resistance. If you could just push against my hand and push against my hand. Good. And turn your head from side to side. Okay, good. Now I'm going to go to the back of you here. If you could just sit up for me. And I'm just going to be palpating your thyroid gland. Have you had any problems with your thyroid? Okay. I don't feel any enlargements or nodules or anything. Your thyroid is intact. Okay, you can sit back now. So now I'm going to check her thorax and lungs. I'm gonna start with the posterior first and inspect her skin. Of course, I'm not gonna disrobe her for this, but feeling for any masses or anything with her skin, and that's good. And then I'm going to, after palpation, I'm going to percuss. I'm going to compare each side as I percuss. Okay. Any pain there?
No.
Okay, good. And then I'm going to auscultate her breath sounds through the back of her lungs here. Deep breath. And deep breath. Okay. Deep breath. And deep breath. Good. Deep breath. And deep breath. Good. Okay, now if I can get you to sit back, I'll do the same thing anteriorly. I'm going to inspect her chest, and I'm looking for, of course, symmetrical movements to the chest as she breathes, and palpating for any abnormalities, lumps, or anything on her chest. Or have you had any problems or any trauma to your chest? Okay, so I'm going to auscultate her breath sound. Deep breath. And deep breath. Okay. Okay. Deep breath. Okay. Deep breath. Okay, good. Okay. Now I'm going to have you to lean forward, and then I'm going to have you to exhale as I listen for a murmur. And I'm going to tell you when to do this. Okay. And I just need you to lift your left breast for me as we do this. Okay. Now if you can just exhale. Okay. There's no murmur auscultated there. Okay, now I'm going to move to, I'm going to be looking at her skin for any abnormalities or lesions or anything. And as you can see, her skin is it's clean, dry, and intact. It's warm to touch. I'm going to palpate her wrist, if we can just move your wrist up and down. And then I'm going to palpate your radial artery. Okay, and your brachial. Usually we like to do this at the same time just to compare. Okay. So I'm going to get you to lean forward with your shoulders and lean your shoulders back. Need you to do like a internal rotation of your shoulders and an external rotation of your shoulders. And if you could just shrug your shoulders for me. Okay. Now hold your arms out straight and then turn them up. Okay, your hands up, and I'm going to test the range of motion in your hands as we did that. Make a fist for me, spread your fingers. Now I need you to touch each finger with your thumb. And if you could just grasp my hand, okay, good. And push against my hand and then pull back towards you. Okay, good. Your strength is good. Now I need to lay you down. And I'm going to be checking for jugular vein distension. And then I'll be auscultating her heart. So if you could turn your head towards me. Okay, there's no JVD there. And there's no JVD there. Okay. Now I'm going to auscultate your heart sounds. Start with the pulmonic. And I would listen to these a minute apiece. S1 and S2 is heard. Okay, then I'm going to move to your aortic. Good. And your tricuspid. And I'm going to listen to the apex of your heart. If you could just take your left hand and hold your breast up for me. Okay. Now I'm going to do this again with the bell of my stethoscope to listen for any abnormalities. Okay, one more time, if you'll just hold your left breast up for me. Let's just get right there. Okay, there's no murmurs heard there. Okay. Okay, I'm going to ask you to lean forward once again. I'm going to listen to the bell of my stethoscope with you leaning forward to note if any, and hold your breast up for me, checking for any murmurs. Okay, I've not heard any murmurs there. Okay, now I need to get you to lie down for me again. And I'm going to move to your abdomen here. I'm inspecting her abdomen for any abnormalities, or I'm checking for symmetry. I'm checking her skin, but of course I'm not going to remove her clothes. Next I'm going to auscultate, and I'm going to start here with her right lower quadrant. And I'm just listening for the vowel sounds right now. Okay, and then I'm gonna loosen her aortic artery. And then her renal arteries. Okay. And then I'm going to percuss in a zigzag pattern. You have any pain when I do that? Okay. Any pain? Okay, that's good. And then I'm just going to lightly palpate her abdomen and feel for any lumps or masses or anything. Any pain? Okay, her abdomen is soft and non-distended, non-tender, as she says. So that completes the abdominal exam. So I'm going to move on to check her range of motion in her hips. So I'm going to, Ms. Wise, I'm going to take your knee and flex it up, and I'm just going to move your hip outward and move it inward, rotate it, and then I'm going to ask you to push against my hand. Good. Any problems or pain when I move there? Okay, so I'm going to do the same thing here. Rotate it out, rotate it inward. Okay. And push against my hand. Okay. Okay. Okay, and her strength was good bilaterally. Okay, so now I'm going to inspect her legs, and we're looking for symmetry and skin characteristics and hair distribution. Of course, I'm not going to disrobe her once again for that. I'm going to check her popliteal pulse. Okay. And I'm just going to remove her shoes just so I can check her pulses in her feet. Good. 2 plus. And 2 plus. And her feet are warm and dry. I'm going to ask you to push against my hand and pull back towards you. And are you having any trouble when I rotate your ankles there? Okay. I need you to run the heel, your heel over this shin here, and do the same thing with the other leg. Okay. And then I'm going to test your Babinski sign, and that one's negative, and this one is negative. Okay. And then, if I could get you to sit up for me and dangle your legs, I'm going to test your, let's see. Okay, push against my hand. Okay, and then I'm going to check your reflexes here. Wow, that one's good. Okay. And I'm going to get something and check her for light sensation. Okay, I'm going to be touching you very lightly, so tell me when you can feel this.
I feel it.
Okay.
Feel it. I feel it. Feel it.
Okay. close your eyes for me?
Feel it. Feel it. Feel it.
Okay, good. Now, one more thing here. Check here. Okay. Okay. Now, I'm going to put an object in your hand. Close your eyes. And I want you to identify what that object is.
Okay.
Okay. And I'm going to do the same thing with the other hand.
Cell phone.
Okay. Now, I'm going to check your position sense. So I'm just going to be moving your fingers around. So tell me what position this is.
Up.
And this one.
Down.
And this one.
Up.
And this one.
Down.
Okay. And I need you very quickly to move your hands just like this, as fast as you can. Okay, good. Good. Okay, now I need you to stand up. And if you could just walk across the room. And when you come back, if you could just walk heel to toe for me. Okay. And can you walk on your tiptoes? And, okay, now walk on your heels. Good. Okay. Now, if you could come right here and just kind of bend over this table, I'm going to check your spine to make sure that looks like her spine aligns good as she bends over. Now, if you could just lean to this side and then lean to the other side. Okay, good. So she has full range of motion there in her back. Now, if you could turn around and grab this table here, and I just need you to bend your knee up slightly. Okay, and bend that knee up slightly. All right, and this concludes our exam. Thank you very much.